Hi there, this is Dr. Evan Osar with Integrative Movement Institute. Hope you're having a great Thursday. Hope your week has been going well and you're getting set for empowering your clients before you head off to the weekend. As you can see, outside here in Wisconsin is a beautiful summer morning. What's up, my friend Pete? My best friend from back home in NJ. Thanks for being on. So today we're discussing the training of the core in our older clients. And we hear many things in our industry about training the core. And there's lots of good information out there. And obviously when there's good information out there, there's lots of not great information and lots of myths around training the core. And if you were part of our pre-con, Robert Linkle and I were out in his bunker last Thursday for our pre-con a week ago. It seems like so long ago. Thanks for all of you that were there. Truly appreciate you guys spending that afternoon with us. We discussed the importance of training the core and the importance of rotation training. And more importantly, the control of rotation. Because lots of your clients will come to you and say, hey, I need to strengthen my core. I got a weak core. My doctor says I have low back pain, so I got to strengthen my core. And unfortunately, that's a myth. And many of our clients are being led into suboptimal exercise strategies because of this myth. So one of the things about training outside, you get this going on. So one of the things about training the core is we want to teach our clients the truth from the myths. And one of the things about understanding truths versus myths is understanding your functional anatomy. That's why Jill and I created 2 Anatomy Geeks. It's a series we created so that you understand the functional anatomy and how that applies to motor control. Motor control is how your brain connects to and tells your myofascial system, your muscles in your fascial system, what to do. It receives information from your proprioceptors. Proprioceptors are everywhere in your body, including your skin, your muscles, your fascia, all your connective tissue, your eyes and your vestibular system inside your inner ear. And then it creates the most optimal motor response or muscle response. Now, as it relates to training the core, especially your older clients, we have muscles that are on the surface that you look in the mirror, that's where you see your fitness models, not me, obviously. You see your fitness models with their 6-pack abs and their obliques, and you're like, oh my God, I want my abs to look like that. Well, that's great. However, we get lots of clients that are coming in with that same look and have low back pain. I actually just consulted with an athlete yesterday. He's Olympic hopeful. Like he's a track and field Olympic hopeful. And he's like, yeah, I have a weak core and I feel like my inner core isn't as strong as my outer core. This dude was jacked. Like he looked like something that was chiseled out of marble. Like massive shoulders and chest, massive like 6-pack block abs. So this guy was in incredible shape. You think about this. If he's at that level, the probably 1% of 1% of athletes in the world trying out for the US Olympic sprinting team, does he really have a weak core? Or does he have an imbalance between some of those deeper muscles, the ones inside that actually hold and control the joints in the right position versus the ones on the outside? Now, today, we're gonna focus on the outer muscles. And lots of our clients are like, I want to train my core, I want ab exercises. But it's really about teaching your client how to control, align and control their cylinder, the thoraco-pelvic cylinder, the rib cage over top of the pelvis. Because this, and here, is the core of the body. And we want to teach our clients first how to align and control that position. It's not about doing crunches, not about doing leg lifts. It's not about doing oblique twists. It's about teaching your clients how to best align and control their cylinder. And too much emphasis is being put on strengthening the core and not on aligning and creating the best motor control strategy for the core. So that's the first myth. We'll discuss a few more in the next part of this series. So how can you train the core and teach your clients how to better align and control? All you need is simple tools. And that's why I love training outside, because all you can bring is a simple tool with you to train the core. So the first thing we teach our clients how to do is better align and control their cylinder, where optimal alignment is. We'll talk more about that in the second part of the series. Next, we just teach our clients how to train fundamental movement patterns, maintaining alignment and control. So first, we're not isolating the posterior oblique chain, but again, we're training the posterior oblique chain and that extensor chain. So a simple pattern you do is a hinge and pull. So here's how it looks. You you align and control. So you align that head and neck, you align that thoraco-pelvic cylinder, step back, and then it's a hinge and pull. Hinge, pull. So you're not over contracting, you're not over squeezing, you're just teaching the client how to maintain alignment through that frontal, I should say sagittal plane of motion, teaching the client how to maintain alignment and control through a pulling motion, through the sagittal plane. Teach your clients how to control sagittal plane motion first before you start training other planes of motion. Now, so that's for the posterior or the extensor chain. Now, what about the anterior chain? Well, that's obviously your chest, your abdominals, and your hip flexors. Well, now you just flip around. This is a more challenging pattern for clients because they don't usually are dealing with forces that are pulling them back this direction. However, that's a function of the abdominal wall, is to bring the rib cage down in the front and maintain the position of the pelvis underneath the rib cage. So just flip around now, and it's the same thing. We're gonna hinge, then go overhead to control that motion. So it's hinge, overhead, control that motion. Hinge, overhead, control that motion. Breathing. So we're gonna breathe in on the way down, breathe out. So you're bringing the ribs down on the way as your arms go up. So you're teaching the abdominal wall how to maintain that control. So now we've got the posterior oblique chain, we've got the anterior oblique chain. Now we're going to train the control of rotation. We talked a lot about this during our pre-con. So if you weren't there, the concept again is teach your clients first how to control, not produce, how to control rotation. So basically, these are the anti-rotation patterns. I don't like that term because it sounds sort of negative, right? Anti-rotation. It's about controlling rotation. We call these rotational control exercises. So again, there's no difference. We align and control the cylinder, step out, and now it's out and back, out, back, not changing alignment of that cylinder. So teaching the client how to maintain cylinder, rotate around the hips, but maintain control of that cylinder through the pattern. So from behind, align the cylinder, stack the thorax over the pelvis, and then it's out, back, control, out, back, control, out, back, control. So that way, you're teaching the client how to use those superficial muscles, as well as the deep muscles, to align and control the cylinder and teach those core muscles, the abdominals, the oblique abdominals, the QL, the erectors, the lats, the pecs, all these muscles that attach to the thoraco-pelvic cylinder, teach them how to align and control the cylinder and resist getting pulled out of that motion. So I hope you enjoyed that series. I hope it made sense to you about how you start working with your older clients with low back and or hip and or knee issues. Teach them how to align and control the cylinder. Next time, we're going to share with you how to train that deeper core, the muscles whose job it is to send proprioceptive signals back to the brain about position, about movement, and about load. And why that is, for many of your clients, just like my sprinter, I'm going to share with you what I did with him, why many of your clients, and especially even high-level athletes, have more issues with their deeper core than they do with their superficial core. So we'll talk about that next time. And watch your inbox, watch Facebook Live. We're gonna do a 2 Anatomy Geeks summer sale. First time we've ever done this program in this manner. So we look forward to seeing you for our summer sale. Tell you how to get the best resource, one of the best resources on the market. I think it's the best resource on the market to learn functional anatomy, and more importantly, apply your functional anatomy knowledge to your assessments, your corrective exercises, and your functional exercise progressions, so that way you become a specialist for your clients and differentiate yourself from the rest of the noise in the industry and attract more of those clients that need, want, and will pay you for your expertise. This is Dr. Evan Osar. Get outside, get active, empower your clients. Let's go make this world a better place. Thanks for watching. We'll see you next time. If you have any questions, put them down in the messages below, and I will answer them later today and or tomorrow and or Saturday, and I'll get back to you. Take care.